Good morning, everyone. Welcome to Hope and Beauty Hair Edition this time. We're going to talk about hair and all things that have to do with that when you're going through cancer treatment. So go ahead, doctor, and I'm going to let you start.
Hi there, I'm Dr. Shamli Singhal, and we're going to talk a little bit about kind of the basics of hair. And I have a bunch of fun facts that probably no one realizes as you're combing your hair, as you're brushing your hair, and all of that. Next slide, please. We started these seminars and these discussions really because as you listen to patients, I'm a surgical oncologist and I've been treating patients for about 20 years. And some of the patients come in and they say, well, I always wanted to be pretty. I always wanted to have to go through this process. And as I went through this process, I didn't realize I had dry skin, I had flaking hair, I had discoloration, and nobody ever told me why I have that and what to do about it and all of that. And so this is Brigitte. She's one of our patients, and she really talked to me about this. And that's why we started doing these classes, is really to get more information out to people so that they don't feel so alone in this process. Next slide. And so this is what Brigitte said. She said she went to the salon, she went to the beauty counter, she went to the nail place. No one had any idea what to do with my problems, and no one wanted anything to do with cancer patients. Well, I'm a surgical oncologist, and Becky, Brooke, and Julie have spent our whole lives wanting to help people with these problems. So if you have one of these problems, please do come find us. Next slide. The thing that I wanted to emphasize about this is that when you go through the cancer treatment, it changes the way you look. And so therefore, it also alters the way you feel about yourself. And so most patients have this idea that they want to be normal. They want to feel that the day is, that they get up, they brush their hair, they do all their usual things, and they can look in the mirror and feel normal. But when you lose your hair, you lose your eyebrows and things, the person looking back in the mirror isn't the same person you expect. And so there's this pain that goes along with that. And many patients, and I can say that for my many years of practice, is that they don't talk to the doctor about these things. They talk to lots and lots of other people, but they never talk to me about it because somehow or other they think it's a vanity item. And I'm so lucky to be alive. Why should I worry about my eyebrows? But it really bugs me, and I really wish there was something I could do about it. Anyway, so they never talked to me about it. So I decided that we would talk to you about it and take that one on. But if you look at it and you think about oncology self-care and you say, okay, well, this is what we need to do to help ourselves to feel better, then this is just part of treatment, and we just include that in there. So our agenda today is I'm going to talk to you about the basics of chemotherapy-induced hair loss. Brooke is going to talk to you about the clean ingredients and the products that you use. Becky will talk to you about solutions for managing hair loss, and Julie's going to talk to you about relieving stress and anxiety with scalp massage. And then at the end, we're going to have a Q&A with the panel and ask all your questions, put them in the chat, and we'll do our best to answer them. Next slide. So, and the spoiler alert for all of these things is your hair almost always grows back. So let's talk about the life cycle of the hair. Now, in the normal pattern of things, there's about 100,000 follicles that you have on your head, and 150 per eyebrow, and 90 to 160 on your upper eyelash, and about 80 on your lower lash. Okay, so if you don't necessarily realize that, there's a lot of hair follicles on your head, and you only really start to notice hair loss when you've lost 50%. All right, every single day for most people, you lose 50 to 100 hairs. So if you have this idea that you're losing lots and lots of hair, remember 50 to 100 is about normal. So when you brush your hair, you see it in the shower, all that stuff, it's 50 to 100. The three phases of hair growth are anagen, which is growth phase. About 90% of your scalp is in anagen at any given time, and it lasts for about 2 to 6 years. So your hair is on your head. And remember, your hair grows only about a centimeter a month. So as much as you think that, oh, my hair's growing so fast, it grows about a centimeter. And as you get older, it grows less than a centimeter a month. Then there's a transition phase, which is called catagen, which is 2 weeks to a month, where the hair follicle is starting to involute. And then the telogen phase, which is where it's actually just shedding your hair. So those are the three categories that we talk about. Next slide, please. So we talk about the formal term is called chemotherapy-induced alopecia, which is the thing that people dread about chemotherapy, and it negatively influences your body image, your sexuality, your self-esteem, and a general sense of quality of life. So all of those things about looking in the mirror, about going out to the grocery store and not feeling yourself and not being able to, you think everyone's staring at you, all of those things are involved in this hair loss. And so it affects your body and your mind as much as it does the hair on your head. Next slide. So where do you lose your hair? And most people are very fixed on the hair on their head, but actually you lose hair everywhere. Everywhere that you have hair, you can lose it. So it's usually on the front and the scalp, frontal part of the scalp. You can lose eyebrows, you can lose eyelashes, you can lose nose hairs, ear hairs, hairs down there, and beard hairs, and underarm and legs. So it's, even though most people are really fixed on the hair on the head, it really does a full body experience. Next slide. So let's talk about the types of treatments. And the reason that I mentioned this to you is because we have evolved into multiple different kinds of treatments. So not everybody gets traditional chemotherapy. There's targeted therapy with antibodies, there's hormonal therapy, there's immunotherapy, there's radiation therapy to the scalp, surgery to the scalp, and all these multi-drug regimens. And all of these treatments, to one extent or the other, can lead to hair loss. The big one is the chemotherapy agents. All right, so antimicrotubule agents such as Taxol, paclitaxel, all of those, 70, 80%, 90% of people will lose their hair with those. Now, it's a very common regimen. It is probably one of the regimens that's involved in lung cancer treatment, breast cancer treatment, prostate, ovarian. So there's a lot of those. Topoisomerase inhibitors, which are things like topotecan, irinotecan, any of those that fall in that category, it's about 60 to 100%. There's another category of alkylators, which is 60%, and antimetabolites, which are 5-FU, things like that. A much lower, 10 to 15%, but again, it contributes to hair loss. The one that people forget, which I'll just talk briefly about, Becky, is all the anti-estrogens. So all of the things, Arimidex, tamoxifen, all of those things will also lead to hair loss, because as you get older, you lose your hair. But if we put you into menopause because we gave you an anti-estrogen, you will lose your hair, and it will thin out, and it will not be the hair that you expect. And then there's also this idea of radiation therapy and surgery to the scalp. When you have radiation to the therapy to the scalp, it will definitely get rid of the hair on your head. And it's a little bit more challenging to get that hair back. Surgery to the scalp, you have craniotomy, brain tumor, any of that, where they make the incisions, is really hard to get the hair back. And it's a big challenge, and especially with the multiple drug regimens that people end up with. So next slide. Now, we talk about the things of chemotherapy-induced hair loss, but if you came into your chemotherapy treatment with some underlying problems, your hair loss is twofold. It's related to the treatment that you got, and it's related to how you got there. So things like vitamin D deficiency, thyroid disease, nutritional status, stress, age, hormonal status. And the one that you probably don't remember or don't think about is there are certain medications that people take for their heart that lead to hair loss. And so if you came into your cancer treatment with any one of or all of these things, then you may end up with a harder recovery of your hair because you have all this underlying thing. So the big ones to remember are anemia, which is iron deficiency, vitamin D deficiency is a big one, and these cardiac medications, because they're sort of undocumented, if you want to call it that, about how they affect your hair. So have the next slide, please. So I wanted to talk to you, and I'll verbally tell you about two things. One of which is there's a there's two. You may not appreciate this, but there's two kinds of hair loss that you can experience with cancer treatment, and one of them is called telogen effluvium, which is where you shed, and you have this. When you touch your hair, you get clumps of hair that just fall out, and there's a test that we do that is sort of a simple test. So if I did it right now and I just pulled on my hair, I should get 3 to 10 hairs per clump that I'm pulling out. If you have more hair loss than normal, it might go up into the three, 10s, 15, somewhere in there, and you might get those hairs. When you have chemotherapy induced injury to the hair, when you pull out hair, it comes out in these huge clumps, and you shed it. And what it is that the hair is not sitting well in the scalp, and so it pulls out very easily. So when you do this hair pull test, you can get the hair just pops right out. Okay, that's one kind of hair loss, which is usually from monoclonal antibodies, immunotherapy, and it's this kind of increased shedding. Then there's called anagen effluvium, which is a different kind of hair loss. And that hair loss has this increased shedding because the hair pull and it's sitting inside your head, not sitting as well, so you can pull it out. But what you notice of the hair is that it breaks. So if you look at the end of your hair, you can then see that it's broken. And this affects about 90% of your scalp. And a lot of the Taxol, doxorubicin, those lead to this break plus hair shedding, which is, maybe it's a little too much detail, but it's just an interesting point as to how you have to deal with it, because it's not just the hair falling out. Sometimes it can be breakage as well, that the hair breaks. There is one item which people don't actually talk too much about because we're so fixed on chemotherapy losing your hair, but there's a medication called EGFR receptors, and those EGFR receptor, it's HER2/neu, it's some of these other ones that people use. They lead to increased hair. So you end up with those Groucho Marx eyebrows, and you end up with hair on your face, and some of these other, you don't get hair where you want it, but you get hair where you don't need it. and those are the EGFR receptors. And so it's just a point. We do talk about hair loss, but there is this place where hair gain is a bit of the problem. Now, we have talked endlessly on different forums and different things about what can you do, and Becky's going to spend a lot of time on what you can do. I'm only going to mention the scalp cooling because it has become more prevalent. It has become a little bit less expensive. The idea here is that if you can cool down your scalp to less than 18 degrees Celsius, you can then decrease the blood flow and cause vasoconstriction to the hair follicles. So the chemotherapy doesn't get to your follicles. And you have about 50 or 60% of people who use the scalp cooling technique will then have no hair loss or limited hair loss. Now, all that being said, putting cold ice on your head in this manner for 6-7 hours can give you a wicked headache. So that's the downside of that. Next slide. So Becky's going to talk more about this, so I'm going to skip this slide. Next slide. And I put this because somebody posted this on Pinterest, and it gives you an idea of how long it takes. Next slide. So I'm going to turn this over to Becky, because a lot of this stuff that we're going to discuss is really important after we talk with Becky.
Thank you, Dr. Singhal. We're going to move into, and all of this, guys, will be available if you want the references on any of this stuff. So actually, I'm going to turn it over to Brooke, who is going to share with us a little bit of information about what we need to be looking for in ingredients in our hair products. Brooke, I will turn the remote over to you.
All right. Let's see.
arrows on the bottom.
Okay. All right. Oh, it looks a little bit different here than PowerPoint.
Yep.
Okay. Hi, everybody. Hold on. I'm going the wrong way, maybe.
You are. There we go.
Okay. Hey, everyone. My name is Brooke Devlin. I am an esthetician with, my own company, Brooke Christina Skincare. I'm located.
Uh-oh.
Talk about hair care ingredients, and I'm going to go over some information about which ingredients to avoid, which ones can be helpful, and also tips on selecting your hair care products during cancer treatment and also after. So as Dr. Singhal was saying, during the journey with cancer, your scalp and your hair growth, I don't know what's going on here. Maybe Becky, you can take over the remote. I'm not sure what's going on.
It doesn't like to play nice sometimes. So let me go back here.
Okay.
And we'll get you to the beginning.
Yeah. No, this slide is good.
Okay.
All right. So basically, all this slide is saying is that the products that you're using before aren't going to be necessarily helpful or healthy for your hair and your scalp during cancer treatment. So the reason being is that, as Dr. Singhal was saying, the medications are going to, cause hair loss and also compromise your skin on your whole body, including your scalp. So we want to do everything we can to take really good care of the scalp and make sure that it's not dry or irritated, itchy, that kind of a thing. So it won't necessarily mean like you have to make this change forever, but it can be really helpful during treatments to look out for ingredients and focus on what you need in order to help the scalp be as healthy as possible. Okay, next slide. So the 6 ingredients to avoid. Of course, there's many more, but I'm not going to tackle like 500 different ingredients during the presentation. Sodium lauryl sulfate, which you might have heard of. It's in a lot of cleansers and soaps. Quaternium 15, fragrance, diethanolamine, or DEA, and imidazolinidole urea, and sodium chloride. So we're gonna just go over these 6. Next slide. Okay, so sodium lauryl sulfate. Here you have a little picture of a pup in a tub with lots of suds. It is a foaming agent, so it's going to create those, foaming suds. And what this does, though, is it strips your hair of natural oils, which then breaks down the protein or keratin in your hair, and it can also halt hair growth. The reason being, these 6 ingredients are pretty harsh. And so we don't want to use anything harsh on your body during treatment. We want everything to be gentle, mild, hydrating, that kind of a thing. So next slide. Quaternium 15. This is a preservative and antimicrobial. All products need a preservative in it. However, this one in particular is not going to be helpful for you or really for anyone. It's pretty hazardous. There's been studies done on this. Of course, I want to mention that in the studies that are done on these different types of ingredients like parabens or PEGs or, etc., they study the ingredients in a high concentration. So none of this is meant to scare you, but it is, research that's been done. So that's what we want to share. There is a high risk with this ingredient of, Oh my God, my phone went out. Okay. There's a high risk of an allergic reaction, and it also releases formaldehyde chemically. Next slide. Fragrance. So it can be listed as parfum. It gives a scent to the product, as we all know. Usually these are produced chemically, which, you know, is a synthetic fragrance. So it's also an endocrine disruptor. It changes certain levels of estrogen and testosterone in the body in high amounts. So this might cause further hair loss. As Dr. Singhal was saying, the imbalance of your endocrine system is definitely not good for hair loss. Either way, it encourages, you know, imbalances, and it can also cause allergic reactions on the skin. You'll hear a lot of people that use you know, perfumes, or I mean fragrance in general during cancer treatments. It's not great because you have yeah, I mean, it could make you nauseous. It could, you know, really kind of um, be disruptive in your personal care routine. And it really is something that people have a lot of allergic reactions to. Next slide. So I'm going to, okay, diethanolamine, or DEA. What it is, it's an emulsifier. It produces that lather substance used in shampoo and conditioners usually, kind of similar to sodium lauryl sulfate. In studies, it caused skin lesions in mice. Of course, the chemical was put directly on the little mice's skin. And it builds up the protein or keratin, and it creates something called hyperkeratosis. So definitely don't want that. It can be damaging to the scalp because of its harsh chemical reaction. So on maybe on like clean beauty websites, they'll say like no DEA. I usually recommend that anything that has like a 3-letter abbreviation is not necessarily going to be the best. So like PEGS, or I can't think of anything, EDTA, DEA, you know, that kind of stuff. So that's something to look out for. Okay, imidazolinidol urea. It's an antimicrobial preservative, and it just basically prolongs shelf life. So this also, like quaternium 15, can release formaldehyde. It is linked to certain cancers, again, allergic reactions and irritation. And because of its harsh chemical reaction, it is damaging to the scalp. Okay, so next slide. Last one is sodium chloride. It's basically salt. It's a thickener in different products like shampoo. Salt can dry out the skin, it can dry out your scalp, and that can slow down hair growth as well. Next slide. Okay, so top soothing agents or ingredients. Calendula extract is great, also known as pot marigold or garden marigold. It has a lot of antioxidants. It helps to calm irritated skin. It protects and hydrates the scalp. So it's a really, really good antioxidant for your scalp. Aloe vera, a lot of us have heard of the great properties of aloe vera. It's soothing, it's hydrating, and it actually balances oil production. So with the, it helps repair the scalp so that it's not producing too much oil and it's not too dry as well. With the marshmallow, I spelled that wrong, but it's a marshmallow root extract. It's really nourishing and soothing to sensitive scalps. So that's one that not a lot of people know about. And then also squalene. And so this is actually the same consistency of oil that our skin produces. So the skin is really receptive to squalene. It's an antibacterial, very hydrating, non-greasy. So this is also a great ingredient to have in some of your moisturizing hair care products. Next slide. Okay, so I always kind of have a slide like this in my presentations. What you want to type into Google when you're looking for your products, if you don't already know of something, like on the Hope and Beauty website, I know they sell gentle hair care products, but just in general, the rule of thumb is to look for something mild, gentle, fragrance-free, and going to like the Credo Beauty website, Pharmaca, or Detox Market, something with like no fragrance. I think that's number one. And every product you buy, if possible, should be focused on scalp health. And even using like something calming, like a calming balm or moisturizer that can help with irritation and dryness. You want to kind of delay the hair growth products until after the cancer treatments are completed. But even when you're doing that, still focusing on clean ingredients as well. Okay, so that's it for me.
Thank you, Brooke. That's
Yeah.
awesome, you guys. I wanted to share too. I just saw a study this morning that said that the products that we use definitely impact our health. We ask this question, and people ask us this all the time. They said that they did a little test with a group where they had them take out their personal care products that were harmful, that were showing up in their urine, and in only 3 days, there was a 50 to 70% decrease in those chemicals in their urine. So it makes a difference, and it doesn't take very long to clean up your act. So thank you for that, Brooke. That's awesome. Okay, so I'm Becky, and I'm going to talk a little bit about wigs and temporary hair loss solutions. Because remember, when you lose your hair, you're not going to want to have the perfect wig. You're not going to want to pay $5,000, which I've heard people have done in the past. Then they got it, they didn't like it, they were stuck with it, right? There's no need for that. This is a temporary solution, and we're going to talk about all the different ways that you can do that. So we're going to talk about scalp care and prep a little bit more in detail, how to decide if a wig is your best option, because not everybody wants or will wear a wig. The 3 first most important steps when you're choosing a wig: some hair and wig loss options, scarves, hats, and other head covers, brows and lashes, and then we'll end with some resources. So scalp care. First, there's 3 things: keep it clean, keep it hydrated, keep it protected. So most of the chemotherapies and the medications that you might be on when you're going through cancer treatment do cause photosensitivity. So it's really important that you wear the SPF if you're not going to have anything covering your head and you go out. So start with keeping it clean, using a safe cleansing product, and then no scrubbing. Be really gentle with your scalp. It will be tender too when this hair is falling out. Then make sure you're keeping it hydrated. One of the products that we use at my hospitals is the O Skin Love oil. And it's a combination of 3 different oils that are all antioxidants, calming, anti-inflammatory, and they will help hydrate. Put 3 or 4 drops in your hand and then gently pat it on, okay? No rubbing. Keep it protected, like I said, with a zinc-based SPF. Don't use a chemical-based one, because again, remember, at this time, we're trying to limit your exposure to chemicals in general. So the cleaner, the better, okay? And make sure that you are getting the tops of your ears, the back of your neck, all the places that your hair would typically cover, because when we don't have hair, we don't have that natural protection. So wigs. All right, so many choices on this, guys, and I'm going to tell you this. We're going to keep it really simple today, but I'm also going to give you a resource at the end that will go deep into all of the things that we're not going to go through today. But 3 questions to start with. Do you want a human hair or a synthetic hair wig? What style do you want, and what color do you want? I work with people for now 10 years at the hospital, and most recently doing hair consultations for wigs. And what's really interesting to me is the majority of people want to have the exact same color and the exact same style that they had before they lost their hair. Then there's about 30% that go, woohoo, I'm going to go crazy. I'm going to go and I'm going to get me, you know, a pretty fun burgundy wig or a pink wig, or I'm going to do red or blonde or something different that I haven't had before. But the cool part is the choice is yours. You can do whatever you want to right now. So let's take a look at the differences between a human hair wig and a synthetic wig. I'm going to do human first. And as you can see, these are 4 examples of human hair wigs. This is all from a website called wigs.com. And look at the variety in the pricing. Okay, so it makes a big difference depending on what your budget is. Also, just so you know, if you have insurance, they will write a prescription for a cranial, a wig basically, but a prosthesis. They call it a cranial prosthesis, which is a wig. And you can actually get your wig covered by insurance. So keep that in mind too when you're looking for a wig. So human hair, it's gonna look and feel more natural, okay? It's got the right kind of shine, not the Barbie hair shine. It's soft, it's flexible, you can use heat, so that means you can change the style. You can go straight one day, curly the next, okay? But as you can see here, they do cost more. And as I mentioned, I did have a client one time who spent $5,000 on a human hair wig, and then she ended up not even liking it and couldn't wear it. So again, it's not important to pay more, just find one that you like. Human hair wigs can last 1 to 3 years with the right kind of care. And you need to style it each time. So here's the cons, okay? It can be heavy and it will react to weather conditions. So if it's, you know, you curl it and you go outside and it's rainy like it is here in Washington, you will lose that curl, okay? It'll be just like human hair. And that is either good or bad, depending on what you want to do. Synthetic hair, on the other hand, much lower cost. You don't need to style or curl it. Once you wash it, you shake it, that style comes back exactly how it was before, which means, again, it's not going to react to weather conditions, which is fantastic if you live somewhere humid or you live somewhere wet like I do. It can look unnatural. That's the only thing. It can be too full or too much hair, and I find that a lot of wigs, that's the issue. So what you're going to want to do when you get a wig is make an appointment with your hairstylist. Make sure that they have some experience with wig cutting, okay? Because it's not exactly the same as cutting regular hair. And remember, it doesn't grow back. So if you cut it too short, you're stuck with it. So you want to make sure somebody who's going to cut your wig or thin your wig knows what they're doing, okay? And synthetic wigs will last about 4 to 6 months. And this is something that I see all the time. People don't really realize this, and they're wearing a wig past that date and it's matted, frizzy, and now it no longer looks natural. And I think the point is when you're wearing a wig, you want to just feel normal, right? And you want it to look natural. So take really good care of it. They do now have heat-friendly ones. So it used to be these synthetic ones, you couldn't get anywhere near heat, like opening your oven door. You would never put a curling iron on it, right? Because you would just melt it. But now they do make heat-friendly ones, but those only last about 3 months max, okay? Again, just to keep that in mind. Also, this is something new that they're doing, is that they're making blended wigs. So they've got a blend of both human and synthetic. And the reason they do that is because it looks and feels a little bit more like natural hair, okay? But it will have the ease of having a synthetic. So it's a little bit more flexible. Again, you can see the costs are a little bit higher. But look at, those are all real wigs, and don't they look great? I mean, so there's a variety of things that you can choose from. These ones last about 6 months, maybe a little bit more if you take really, really good care of them. So this is kind of a news section, and this is fun because for me, I'm going to say I've got mixed emotions. And that is because, unfortunately, I'm getting a whole lot of 20-something women with cancer. And they don't want a wig, you know, they want to wear the baseball cap. They want to wear the hat with hair, okay? They want to do something that looks more like their age group. And so the wonderful thing is, so that's the sad part, but the good news is there's many, many choices and the prices are really great. Amazon has a ton of them. I think I got this one on Etsy, and I ordered this for a client who's in her 20s. doesn't want a wig, but she had really long hair and she wants to keep that look and feel really comfortable. So, and these run right around $20 to $30, not super expensive. So that's kind of fun. And it's kind of fun to have it as an option, even for those of us with hair, right? You get up one day, you got a bad hair day, you can just put your baseball cap on with your ponytail and off you go, right? So, and that's another thing. Everybody's wearing wigs these days, or I should say a lot more people. So it's not just somebody who's lost their hair with cancer. There is a lot of alopecia in our country. They say 40 million people in the world, women, have some sort of hair loss, which brings me to where you see the toppers over there. These are really fun because I have a lot of healthy clients who have natural hair thinning. So here is an example of a hair topper, and this one has a bang or a fringe. This client doesn't have one and she's going very thin on the top. So you can see it just has a couple of clips and she can just clip it on. And I'm going to try to do this without really messing up my hair because the clips always get caught on there. But, you know, so you can just pop that on and it gives you that fullness. Another thing that it does is it helps with grow outs and things like that. So these are fabulous. And there's many places you can get those depending on whether they're human or synthetic. They can be anywhere from $100 to $2,500. Again, a lot of women wear these, guys. These just add fullness, thickness, or you can have a bang one day and not the other day. If you've ever wondered, how does Kim Kardashian grow her hair that fast when she had bangs last week? She's wearing a topper, okay? And actually, they say that she actually gets the credit for really making wigs much more mainstream, which is wonderful. The one down below that's a halo, it's called. So it's just got hair this way. That one is another one that you would wear a hat with. And the reason that people love those is because if you haven't worn a wig before, wigs are very hot and you will sweat in them, and especially in the summertime. So if you are losing your hair in the summer and you want to just have a little bit of hair on, you could do a halo like that. They come with a band on them as well. So like here's one that I ordered for a client. So this one kind of has a headband on it with a ponytail, and then they can put whatever hat they want to on it. Again, right around the $20 to $40 range. It's very nice options. I also meet a lot of people that say, no, not going to wear a wig. I'll just either go bald and rock it, or I'll wear a scarf. So scarves and hats are also big, and there's many choices. Masumi headwear, head covers. YouTube has a great video for lots of things, but how to tie a scarf in several different ways. And you'll find that when you lose your hair, you'll probably want like that one right down below here, the sleep cap, something that you can wear at night because your head will be a little cold, especially in the winter. But there's definitely all different kinds. And of course, Masumi came out with one that is a hat and a mask. So you can put it on your head or you can wear it as a mask. That is the time frame that we are in. But again, lots of choices and lots of different ways you can do it. And the pricing goes anywhere from, you know, I've seen them at $10 all the way up to $50, like some of these that you see here that are a little bit nicer. Depends on what you want to do. It's nice that there's lots of options. So where else are you going to lose your hair? As Dr. Singhal mentioned in the beginning, your brows and your lashes. Okay, and in the little red box, it's super important. The acrylate. See, I can't say those words either. This is a glue that's used in a lot of lash glues. And you know what? When I looked it up, it used to be we had to watch out for formaldehyde in the glues because we were having reactions with that. Now they're putting this cyanano acrylate in there, and it is, you're not going to believe it, super glue. It's the same ingredient in super glue, okay? So they thought they were doing better by getting rid of the formaldehyde, but they went with this one. And you can see there's plenty of issues with it. A lot of burning in the skin and skin lifting and allergies. So we want to avoid those. So make sure if you're going to use a lash product, check the glue, okay? We kind of use and recommend actually going with different products at this time, just so that you're safe and making sure that you're not going to have any other issues that you need to be worrying about. But there are lots of things to choose from. You can use a powder, which I like. It's a little bit more natural. It takes you just a minute to get used to it. You can use pencils, right, to put those brows on. They actually make brow wigs. Again, watch the adhesive, because if you have thin, fragile skin due to chemotherapy, you could have some skin lifting, like in that one picture down there where the just kind of took the skin off when they took the brow off. And there's also brow tattoos, which is something that you just, on the bottom left there, that you just press on, take it off, and you've already got a beautiful little brow. So there's lots of different things. Again, pay attention to ingredients and just make sure that everything's safe. Lashes, lots of choices. Magnetic seems to be the hot one right now. I ordered some and have been playing with them, and I really, really like them. The one that I found that I liked was the Moxie brand. And there are glue-on ones, but just be careful. Again, watch the glue. And of course, you could do the illusion of lashes, which is what we recommend. And that is using the O Face Love kit, which is using powder. And how do you do that? So for brows, you get a nice angled brush. And the O Face Love kit that comes in the collection, or you can order it separately, has actually 3 colors. So you can use it as eyeshadow, you can use it for your brows, and you can also use it for liner. And that is what will give the illusion of lashes. Little diagram here on how to put your brow on. So you can see, you take your pencil or something and you go right straight from your nose up. And that's your first line. And then you're going to go this way, and that's your arch, and then all the way to the end, and that's where your brow should end. When we teach it in class, we talk about putting a little dot in each of those spots and then go ahead and filling it in. You can use the powder dry, or if you want it to stay on a little bit longer, you can wet the tip of the brush, put that brow on in little hair strokes, and it will stay on all day long. Make sure when you're taking it off, you're removing it with something that's safe for the eyes. So the Gentle Face Wash in the O Skin Love brand can be used as an eye makeup remover as well. It won't harm your eyes and it will take everything off. The Moxie kit over there actually comes with these little remover swabbies. And basically, I mean, they're $6.50. You could make your own by just putting a oil, whatever oil that you have, like the O Skin Love oil, or maybe it's a calendula oil, something that's good and safe, right? And just with a Q-tip, just take off everything that's on your eyes and then use the cleanser, and you'll have a nice clean surface, good for sleeping and ready to go for the next day. So how about hair color? Because this one we get asked a lot. When can I color my hair? Unfortunately, a lot of times with chemotherapy, when the hair comes back, it could be a different color. And I hate to say it, but it's usually gray or grayer than it was before, and or a different texture. So if you had straight hair, it could be curly. If you had curly, it could come back straight. The good news is that for most people, that's temporary. So within the first year, it's going to balance out. Your hair will then become what you had before. But a lot of people ask, when can I color my hair? We really want you to wait 3 to 6 months after all your treatments are done, because your scalp is going to be very tender and fragile. So it's not going to be the same, and so is your hair. This is new baby hair. Remember those, oh, I can't even think of the word now, the antigen, catagen, so right, the different hair growth time periods. That hair in the beginning is very fragile, so you really don't want to hit it with a harsh hair color right in the beginning. So if you can hang with it for just a little bit longer, please try to do that. And then make sure you check with your stylist to see what they use or recommend. A lot of salons now are moving into more of a greener or cleaner type products in general. And I would search out and find a hairstylist like that, okay? The reason that I'm putting this book on here is because this book has everything you need to know about choosing a wig. Because there's a whole lot of things I didn't mention, like lace front, monofilament, right? All of these different things. This book will kind of walk you through the different types, how to measure for a wig, because that's really important, how to pick the right one for you. And you can get this on Amazon. It's called Wig Ed. Okay, so your wig education, everything you need in a really beautiful little book. YouTube has many, many tutorials. I tease often and say, you can learn anything on YouTube. Now, some things we don't want to learn on YouTube, but this is a great resource for you because you'll get to hear from a lot of people about how they chose a wig, what works, what doesn't work, and you'll find a gem or two in there. So check out YouTube. How to tie a headscarf, which I showed you before, and then you can connect with a professional. You know, I do this all the time, the virtual consultation. So if you don't have somebody, you can reach out to me. But most cancer centers have a wig salon, and they are almost all now set up for virtual consultations because of COVID. So you can do them from anywhere, okay? So keep that in mind. If you ever need help, reach out. Different references. These are all of the things that I discussed today. So if you guys want a copy of this and need these references, just let us know. And now I'm going to turn it over to Julie. She's going to talk about relieving stress and anxiety with scalp massage. I'm excited. Ready for you, Julie.
Perfect. All right. So am I still muted? It says I'm muted. No, I'm not. This is my one slide. So now you can just breathe. You've had a lot of really good information. And now we're just going to take a few minutes to nurture ourselves. So before we do any scalp massage, we all have been looking at a screen, and we may have been sitting as well for a while. So I always like to do some sort of stretching so that when we come to massage the back of our neck or turn our head in any way, that we are already warmed up. So we're just going to sit with your spine straight up if you can. I prefer for you not to be leaning against the back of your chair, but if you would like to, you can. And what we're going to do is we're just going to turn our head to the right. Remember, on the screen, I'm going to look opposite and center, and then look left and center and right and center, left and center. And we'll bring our, or try to bring our chin to our chest. So just looking down, keeping your back straight, coming back neutral. Now this time you're going to come back with your head, but don't try and go too far, and stop at any point if it feels painful. So just gently coming back. If you want, you can even open your mouth and just relax for a second. And move slowly back to center so you're not dizzy. If you're dizzy, just stay here for a moment. Next time, don't go back as far. Again, coming back with your chin toward your chest. Again, if you're dehydrated or in chemo or dizzy, just don't go as far. Coming back center. And coming back again. And center. This time, what you'll do is you'll try to make your left ear come to your left shoulder. Just gently come back center. Right ear to right shoulder. I love looking at the picture of everybody's head, different directions. Always makes me have fun on Zoom. And center. Moving slowly. Come to the left. Sorry, my phone is on. My son broke his foot yesterday, so we're waiting for the doctor's phone call. Head is center. Right. Center. And now we're going to try a little more stretch. So come back to the left. And bring your left hand on top of the side of your head. And gently give yourself just a little stretch. Don't push it. Just a little stretch. And this will help us when we are massaging the side or the back of our head. And close your eyes and just breathe for a moment. You should not feel any pain in your neck or shoulder. If you do, then just release the tension or come back neutral to center. And release. Do the same thing, moving your head slowly to the other side. So right ear to right shoulder, right hand comes up and gently stretch. If it's difficult to look up, you can look down. Releasing, coming center. And just one more quick exercise to just warm us up. Just shoulder rolls, coming back. We spend a lot of time on Zoom, so we just want to take care of ourselves a little extra. And forward. Oh, we got to do one more. Okay, so as I watch our good doctor here. So you can put your hands out in front of you. Rotate your palms upward. Bring your hands to your shoulder. And now do your shoulder rolls out. Four. And I'm at 5. So now you can go the other direction for 5. Good. Perfect. I am not having me on screen, Becky. Do I still have the PowerPoint there? Can you take the, just might be easier to see. Thank you. Okay, I think if I talk, it should come to me, correct? Speaker view. Is it showing me now? Because mine sees you. Okay, so this will be fun. I'm going to do it and watch Becky full screen. I don't know why, but it's a fun day. And, you know, this is what we learn is just to be with the present. Okay, so a few things. We know that our heart pumps our blood, right? And it comes out, the blood goes out to all the different areas of our body. And if we think about our scalp is far away from our heart. So our hair follicles and our scalp don't get as much blood and circulation as they need. So why am I talking about this? Because blood brings nutrients and oxygen. Okay, so it's really important. And this is why when you go and you have your hair done, that they do a rigorous scalp massage, but we are not going to do a rigorous scalp massage because we have learned how the skin changes during this time, and your scalp is made of skin, and your hair changes during this time. And I don't want you having big clumps of hair that you're pulling out during this time. So what we are going to do is we're going to use our fingertips. So not your fingernails. You're not going to use your fingernails and scraping your scalp, okay? That was a funny way to say scalp. I don't know where that came from, but okay. So we're going to be using our fingertips, and mostly you're going to be going in circular motions. There's no one pattern to it, whatever feels good. But what we're doing is we're increasing the circulation, and we're also helping to reduce with stress and anxiety. So some of you may find it easier, for example, to be massaging on one side of the head at a time, which is what I do with my clients. Some of you, it might be harder and easier from a coordination standpoint to start massaging with both, okay? So we will do one at a time. And then if you need to use two, you can. You always have your other hand to support. And this is why I wanted to show one side at a time. So mostly, we hold our stress here, right? And we hold our stress here, and we can hold it all in here. So if we just take the pads of our fingertips right above the ear, and you're just going to massage and circular. And again, you can support your head with the other hand. And you're just moving slowly, rhythmically, as if you're going to fall asleep. So your other hand's going to keep you awake. And just bring it all the way back to the back center. And then you can come back again by your ears and do another pass again. If you want to be creative and feel really coordinated, you can reverse direction. I'm not that coordinated. So we're just working on just releasing any tension. Okay. And then on your next pass, just come a little higher, right? So I was here, you can overlap, but now I'm a hand up. Same thing, moving very slowly. You might feel the shape of your head. Some areas might feel a little more sensitive. If your scalp is dry, you might notice some flakiness or some scabs if you have any folliculitis. It's okay. Now, I personally like the back of my head. Feels good. Okay. So now when you're finished with that side, we're going to go to the other side, right? So you can try supporting your head. Again, you're going to start with your pointer finger just above your ear. And slow. And if you want to, you can even partner it with your breath. Slowing your breath down, doing some belly breathing. When you're done with that pass, just coming again, same pass, same spot, where we hold all our tension. And your self-care routine should take 5 minutes. You don't need product, but if your skin and your scalp is very dry, you can use some of the oils, just like Becky mentioned. And on your next pass, again, coming higher. If you notice that your arm is getting too tired from massaging, then you can relax your arms for a moment or do any of the stretching that we just did with bending your elbows. Okay. When you're done with that, just rest your arms for a moment. And we're going to do the top of our head, and then we're going to finish with the back. Hopefully it's feeling good, nice and relaxing. Okay. So again, we hold a lot of pressure here near our temples, right? So same thing, just massaging. Try them both at the same time. See how that feels. You can stay there too. You don't have to move all the way back if you don't want to. You can use some oils, though I prefer not to, but you can use things like peppermint and chamomile. There is no right way to do this. It's you nurturing you, whatever feels good for you. And then coming to the center here. So if one arm's tired, that's fine. You can lean. So your pressure is a medium pressure. It doesn't have to be too light. Or you can use 2 hands, whatever feels good. And you might notice you might be more sensitive toward the back of the crown even. And now we're going to finish on the back. So we're going to massage. Coming back. Again in circles, either on top of the hair, or you want to be messy like me, you can get in there, but be careful with your hair. Just massage coming down. It's like a little caterpillar moving. And you'll notice there's a little ridge here, the occipital ridge. This is where we hold a lot of our tension. So you can massage straight in the center. You could also, if you wanted to, move your head to the side a little bit. And making sure that you then end to the outside of your shoulder. So your hair should look as beautiful and fun as mine. Again, it doesn't have to be as long. I just wanted to show you that occipital ridge is really nice for you to massage. If you've had lymph nodes removed at all in here and you're swollen in here at all, this is why I did the downward strokes. So our muscles, if we were going to massage our muscles, we would go up. But if you have swelling or anything in there, it's just best to come down, let the body just try and process any of that swelling or inflammation. Okay, that's it. If you're losing your hair, maybe just do it 2 times a week. If your hair is growing back, it can help stimulate the follicles. You can do it every day. Make it a ritual. Could be before you go to bed or in the car before you get your kids from school and you feel a little stressed. This is something easy for you to do for you.
Thank you, Julie.
You're welcome.
That was fabulous. I don't know if you guys enjoyed it as much as I did. I wasn't even thinking about it, but it was like, oh, that was so wonderful. And it didn't take that long. I love it. Love, love, love it. Okay, I'm going to go back to this. And think we're going to go to a few of the products, just so you know, things that we talked about today and things that are available on the shophopeandbeauty.com. If you want to, Doctor, talk
Yeah.
about these.
So I'm going to just talk to you a little bit about it. So at the request of patients, we made boxes and we made different items. These are things that that can help you. This is kind of the full box of different items. This one's a sampler box, and so it's good for you. Some things are for you now, some things are for you a little bit later. It contains stuff for your nails, your skin, your facial lashes, and things like that for now and for 6 months later after you start to recover. This is called the Chemo Companion Box. And so next slide. This is our wellness box, and this is probably one of our best sellers. This box contains some product, all full-size products from O Skin Love. Becky has used them with the cancer patients for over 2 years, and they have worked really nicely for cancer patients. And I'll just say that my husband grabbed one of the Hydrate moisturizers and has been using that and has been very happy with that. And there's some little extras inside this box. One is a Serene spray. There's Integrity sunscreen for you, and there's a little bit of eye cream in there, as well as a angel feather pad that goes along with it. And these is really nice for people as they get their new diagnosis. This is really nice for people as they progress through treatment, because as their skin changes, this is all ready for you. And what people have said to me is that there's so many choices of products, but this one's been tested in cancer patients, and most patients have had really good responses to this, and it's a good ready solution, which I think is great. Next one. These are all hypoallergenic, non-fragrance items, and it's a sampler box. So you can try the unflavored toothpaste in case you have mouth sores in your mouth. There's a mouth and breath spray in case you have really dry mouth. There's the shampoo and conditioner from Chlor, which is hypoallergenic, non-toxic, all those ingredients. And there's an item in here. You can substitute this oil. This is Emu oil. Emu oil is real for super, super dry skin, and it works pretty well for that. And next one. And this is Becky's collection, which comes with a different, and she can speak to this a little bit more.
The only difference here is this is the one that's on my website, and it's got your O Face Love kit. So it's got your brow lash kit in there, as well as calendula oil. But otherwise, it's the same as yours.
Yes. And so we'd love for you to reach out to us. We're about to start Q&A, which is always great fun. So each of our emails and our views are listed here. We have this webinar will be posted on our YouTube channel if you want to share it with your friends or share it with people that couldn't make it today. Our products and blogs are on Shop Hope and Beauty. And if there's any questions or anything, just reach out to us, and we're happy to help.
So let's look at the chat and see if anybody has questions. Does anybody have any questions for us?
It looks like Bianca's hand is raised.
Okay. Bianca, she's a good one. She always has good questions for us. And I don't see a question yet. Bianca, go ahead and put it in either the Q&A or the chat, whichever is easiest for you, and let us answer those questions. And it might be, maybe they don't have questions today. We've pretty much given everything. Is scalp cooling recommended for during chemo? And that will be back to you.
Yeah, so scalp cooling in the US, it has been really tested in Europe, and Europeans have much more availability of it. In the US, it is available to you. It's a little bit of a challenge in that there are 3 brands that make it. The price is a little expensive. It's only contraindicated for people with hematologic malignancies, leukemia, lymphoma, all of those. And many of the breast cancer patients have it. It's one of those items that really needs really big commitment on the part of the patient, because you're sitting in chemo for 6 hours. The thing has to be changed every hour because the ice melts. And you have to have a buddy who can help you put the cap back on, because it's very difficult to put the cap on yourself. It's super tight. And the ice often will give people a headache. So you have to work with, if you don't have the ice under 18 degrees, then it doesn't work. And if it's under 18 degrees, you're more likely to get a headache. So you really have to test it out for you individually.
And you have to really be committed, because it is painful. That cold can be really painful. Insurance used to.
Insurance does not pay for it. And last I checked, it was in the 1,000 to 1,200 range.
Right. And you rent the equipment.
Yeah, and it comes with a big cooling box, and it's a project. You really have to be committed to that thing.
I've only had a few of my patients out at the hospital that actually did it. And I would say it was about what you said. 50% of them had great luck with it. They kept their hair, and the other 50% did not. So you could go all the way through that and still lose your hair. I'm seeing a lot of people who are not losing their whole head of hair. They're just thinning out, which is why those toppers are great. Oral supplements for hair regrowth. Julie said biotin, and that can be good. You have to really watch biotin, and you might want to check with your doctor first, because it can change blood counts and blood results from blood tests. So make sure if you're doing anything internally, you check with your doctor or your medical team first. We do not recommend like your, what is it? Guys, what's the name? Minoxidil? Is that
Minoxidil, yeah.
We don't recommend that during treatment, because it's, number one, expensive. Number two, it's kind of a waste to use it during treatment. So if you're going to do something like that, again, do your research and wait until you're completely done with chemo, so that when you use it, you'll actually get some good results.
So I could comment on the minoxidil thing. The minoxidil, there's two percentages. There's 2% and 5%. It's available at Costco, but the formulation at Costco is sticky. So most people don't really like applying something in the morning and the evening that's sticky. So every compounding pharmacy has a variety of minoxidil, and you can get it on, Hims and Hers and all of these different places you can get it. But the formulation, if it's not sticky, is quite expensive. And it does grow. Your hair will grow back. It is one of those things that it grows back when, as long as you use the product. If you stop using the product, then it does go away. Now, one of the side effects that people, it's a little bit of a catch-22, is that the scalp gets very dry. So then you're catching, you're putting this medicine that's supposed to grow your hair, but it's drying out your scalp. And so now you have to moisturize your scalp, and you have all this redness. So then what thing are you chasing again and again? It really does. It's sometimes good for the eyebrows, not for the eyelashes, but for the eyebrows. If you're having trouble with that 6-8 months down the road, that you want a thicker eyebrow. The other option for eyebrows, which is by prescription, and you have to go to your plastic surgeon or dermatologist, is Latisse. And so Latisse is indicated for eyelashes, okay? And the off-label indication is actually for the eyebrows. So if you have a little stubby of eyebrow, you can put the Latisse on it, but you have to have a little starter to get it to go
in there. And it's anywhere between $100 and $175, which is why we say don't do that while you're in chemo, because it'll start the hair growth, and your next chemo infusion will knock it back out again. So a great option, again, after you're all done, but that's great.
Right. And one thing to remember is that Latisse is by prescription. And the reason it's by prescription is because there have been a rare number of cases in case your eye color changes. And what we've recommended to people is that they do get an eye exam. I mean, don't just take it just because lash boosters or whatever thing you want to do, because remember, you're just very sensitive as you go through chemotherapy. And so you just don't understand all the complexity that can happen. And if you really recognize that your skin, your hair, everything is changed by this medication that you've taken for your cancer, you probably will do much better, not with all of this product that you need to take 6 months from now, not during.
Not during. I agree. Okay, any other questions or anything that anybody wants to, oh, Lori, is there anything more that can be done for patients who have had radiation to scalp and a lot of thick, dead skin accumulation? I typically use calendula oil on it to keep it hydrated and allow it to fall off as it naturally occurs. I'm going to say, Lori, you're probably doing the right thing. If there is a lot, they might want to do some gentle exfoliation by using a washcloth, but I wouldn't do anything harsher than that. Anybody else have anything to add to that one?
So we've had a little bit of discussion about hair transplant because that does come up. So remember, when you look in the mirror, what frames your face are your eyebrows and the front part of your face. So if one is to recreate for surgical patients that have or radiation patients to the scalp, you have to have enough hair on the back of your head to be able to move it to the front. So if you can get even a centimeter of hair in the front, you can then put a topper in the back, because then your face is now framed where just putting, paint. And then there's other things that people have talked about for which there is no data. I mean, there's microblading, there's tattoo ink that you can put on your head. And if you really want to go all out, they're henna crowns. Right? If you really just want to celebrate the fact that your scalp is now a new palette, you can put a henna crown on there and see what inspires you. Again, making sure that you patch test all the stuff that you put on on your head.
And try to avoid the black henna. Although it might look better than the other, it can be potentially dangerous. So make sure you're checking that as well. Julie, you might want to answer this one. At which point in between treatments is a scalp massage being invigorating safe to perform at home?
So for me, if you have new hair growth or if you have hairs that are broken, the integrity of the hair is, when you're doing vigorous, a lot of times you get your hands all in there. So it depends on how you do it. I mean, if you can do it a little more vigorous without getting all tangled in the hair and pulling on the hair, then that's fine. But even just gentle massaging like we did still brings blood flow in there. And of course, you can use things like peppermint, for example, that will also bring that blood flow and be a little bit more invigorating from from an oil standpoint. So I would just, it just depends. If you don't have any hair, right, then it's okay. But once you start having that hair growth come back, in my opinion, it's weak. It's not strong hair yet. So I would just be careful. Being the perspective of not bringing. You're not, in my opinion, you're not going to bring. So the question is, sorry, did you say something, Becky?
No, go ahead, read it.
From the perspective of not bringing chemo activites into the hair follicle, I think I have to refer to the doctor on this. It's controversial where some people will say there's two types of chemotherapies that will stay in the skin and then release after 24 hours. But I personally am not concerned about bringing any of the activites into that hair follicle. You may have a different perspective from a doctor or physician standpoint.
I don't think anybody really has strong guidelines on it. I think you have to look at it as the chemotherapy is going to go into every tissue of your body, and it's going to go there no matter what except for scalp cooling, it will go there because there's blood flow there. Now, how long it takes you to get that to clear is semi unknown, because we don't really punch biopsy people to find out whether the chemotherapy is in there 2 or 3 days later. So I think our best common sense is probably the guidance I would suggest, as there are no guidelines. What seems reasonable and applicable to each person
also,
as well.
I just want to say, going back to the like invigorating massage, scalp massage, if you do use essential oils, you want to make sure and dilute it with the carrier oil, such as sunflower oil or something, and not put any essential oils directly on the scalp or the skin. So yeah, that's all I
Correct.
wanted
Yeah.
to point out.
And you can have sensitivities to it. That's why it's not my favorite, yes, to do.
So we usually ask this question of the panel. And so I'm going to ask the panelists, because remember, no one tells me, the doctor, what's bothering them. So what do they tell you? Julie?
Oh, from a hair standpoint, you know what they ask is about microblading.
Yeah. And
That's
what's
a
your
very
answer?
common question.
Because I don't think they really understand what it is and
Uh-huh.
whether they should or shouldn't have it, but it's something that we do in the spa and the salon. So yeah, I get that one a lot as well. I also get, man, a lot of questions. And when I ask them, what have you asked your doctor? They say, oh, I don't want to bother my doctor with that. But guys, and that's why I teach people, because I think in the spas and the salons, patients are going to ask whatever questions that they want, that they don't feel intimidated asking their doctor. So again, usually it's about products or what can or can't I do during this time. I get a lot of questions about Latisse
Mhm.
and a lot of questions about minoxidil. So thank you for covering that today.
Yeah, Brooke.
Yeah, I get questions. I am someone who actually provides microblading. I do that. There's also scalp micropigmentation. So that means actually doing little dots on the scalp, so that it looks like there's follicles. A lot of men end up getting that kind of cosmetic tattooing, but with microblading, it's how long after I have my cancer treatments can I do microblading? Which I always say, first of all, let's ask your doctor, but generally it's between 6 months and a year. And then also they asked me, what is something natural that I can do to help with hair growth after? And I mean, as far as research goes, I don't know, but I've tried castor oil in like a mascara wand, and I've combed it through my brows before and my eyelashes. Of course, being careful to use a clean mascara wand each time, or wash it off, spray it with alcohol, dry it, for the next time. But anyways, I put that on before bed, and I actually do see some great growth. And it could just be the mascara wand, like going through and kind of stimulating those little hair follicles. And also castor oil is really, it's a conditioning agent. So it's going to help basically make the hair coming out of the hair follicle a little bit more resilient.
Right. I get that a
So
lot.
I'm going to add one last thing to that, and then I guess we'll take any last questions. But nutrition is really important, and it's important on lots of fronts. So the things that you have to pay attention to: your vitamin D levels, your thyroid hormone levels. Just look at your medication profile again. And also look very carefully at anemia, because a lot of cancer patients are anemic for one reason or the other. And so anemia means that you don't have enough blood cells to go to nourish the follicles. So you have to water the ground and make sure that the ground is healthy before you can actually grow something in it.
Yes. And on that same note, there is a book called Eat Pretty. Anybody ever read it?
No.
And it has all the nutrition things that help the different beauty aspects. And it's a great book. So if you haven't had a chance, check it out. Looks like we have one more question from Bianca. Is the scalp pH different during chemo treatments? And is the skin's temperature higher?
So I don't know either of those two things, but Julie and I are in the process of getting some tools to measure all those things. So check back with us in half a year. We might have the answer to that.
So then we'll know for sure. Awesome.
Yeah.
I think, yeah, just from the skin temperature, like if we were just to assume even the skin in general, I mean, there's so many things that factor into the health of the skin. Anemic people tend to be colder, and their extremities are going to be colder as well. So I think, you know, a smoker could be different too. So I think you have to take a lot of these lifestyle factors into account. But yes, the study will show or will help us to see temperature and all those kinds of things.
So check back with us later. Awesome.
Great.
All right, everybody,
you all.
thank you so much. If we don't have any other questions, I think we're gonna call it, and I think that's it. We are good. And you wanna tell them when the next one is and what it's going to be?
Yes, we are planning to do one in September, right before Breast Cancer Awareness Month. We're just double checking on the holidays that fall in there to do that, and it will be on oral care, because that's one of the things that our patients don't really have a lot of information about, is how to take care of your mouth as you're going through treatment. And that'll be in September. So we'll send you an email with the exact date, but we're working on deciding when school goes back and the holidays that fall in September.
Awesome. Thank you, everybody.
Thank you.
We'll see you all.
Good job.
Okay, bye.
Bye.